Good morning, respected chairman, dear friends and colleagues. My presentation on mobilization of hand under wrist block anesthesia at American Academy of Orthopaedic Surgeons at Chicago. Hand stiffness is a major problem following any hand injury. And stiffness is inevitable, preventable, or curable, intractable. We would study how to prevent and how to cure it. Stiffness can be due to mechanical, biomechanical, or psychological factor like fear of movement and pain. Stiffness depends on the surgeon's skill, technique, motivation of the patient, patient encouragement, tolerance power, and psychology. Injury itself sometimes very bad, good, and physiotherapist involved in the physiotherapy. We have been working in ESIS for last 15 years and we daily get 7 to 8 cases of hand injury, and patients go for long leave to get longer disablement benefit. Less initiation and motivation in such patients to this is a economical loss to ESI and factory. There are various grades of injuries, varies from grade 1, which are minor injuries like simple fractures, small wounds without tendon vessel injury, fingertip injuries like this. The grade 1 are simple injuries, which minor hematoma, contusion, simple sprain, subluxation, dislocation of one of the more fingers. Grade 2 severe injuries, intra-articular or compound fractures, deep wounds with tendon injuries. These are grade 2 injuries. Grade 3 severe injuries, grossly displaced fractures, amputation of the fingers like this. Grade 3 injuries are serious injuries, severe crushing of fingers, loss of skin, deglove injury, multiple finger injuries are there. Grade 3 serious injuries likely to cause more stiffness, osteodystrophy, malunited Colles fracture, shoulder stiffness and frozen shoulder. So this is the technique for mobilization of hand and fingers under wrist block. This is the instrument set, simplest. All the 3 nerves and also the dorsal carpal branch of the ulnar nerve are blocked using sensorcaine, plain xylocaine and distilled water. 30 to 40 ml solution is required. This is important. Dorsal carpal branch of the ulnar nerve supplying dorsal aspect of the little and ulnar finger of the ring side. Ring finger are important to block. Anesthesia effect lasts for 4 to 5 hours, sometimes for the full day. The range of movement before and after mobilization is recorded and compared. Active and gentle passive movement of the fingers and thumb started and continue till the effect of block is allowed. Encourage the patient for continuous physiotherapy. This is flexion before wrist block mobilization. This is flexion after wrist block mobilization. So first mobilization is done at 7 to 12 days, second at 3rd or the 4th week, and third may be required in some of the cases at 6th week. So these are various examples. This is before operation, after operation, full flexion, extension. Sometimes if bones are osteoporotic and the force has been applied too much, then iatonic fracture of the metacarpal in one of the cases has been reported. The finger movements before and after the wrist block. Our study, as per the grade, we have done more than 480 cases. Now it comes to 1000 cases study group. We compared the control group and the grade 1 injuries 70% and control 7 in study group. The result we could get 70% at the end of the 6 to 8 weeks and patient resume the duty early. In grade 2, 51% cases recovered fast. Grade 3, 53% cases recovered in 6 to 8 weeks. The number of work days lost per patient also reduced as compared to the group. These are some of the examples before and after the wrist block. The prevention of stiffness is better than cure of the stiffness. Curing stiffness is very difficult. The advantages of the technique: it's a painless active mobilization in the conscious state. It breaks the pain, spasm, fear, stiffness cycle, and in that case kinesthetic sense is preserved, so mobilization is better. It reduces the pain, spasm, immobility, stiffness, glue, edema cycle. It also motivates the patient psychologically when he gets the full flexion, facilitate the other methods of mobilization. No hospitalization is required, and disability assessment shows that it reduces the overall disability of the patient and the duration also. It is useful for prevention of the stiffness in fresh cases. It is better, safer, and economical. The contraindication being wounds or fractures around the wrist and presence of infection around the wrist. These are the contraindication of the wrist block mobilization. So do not give wax bath on the day of wrist block mobilization. We have seen some of the burns and bully on the fingers, so avoid that. The relative contraindications are sudex osteodystrophy and osteoporosis, likely to cause the fracture of iatrogenic fractures and associated with the shoulder stiffness or frozen shoulder. With all due precautions, active gentle mobilization, it avoids tortuous manipulation, avoid heat therapy on the same day. So you have to be very careful in planning and executing. It is ineffective if ineffective or partial block or in a malignant or apprehensive patient, the result you may not get. The main aim is to enhance the other methods of mobilization to prevent the stiffness and allow early resumption of the duty. It also in late cases where there is stiffness, it helps to relieve the stiffness also. At present, no reference is available. First and the largest series of this study, no definite reference establishing this matter are available till today. So this is a PubMed at that time. It has been published in Gujarat Orthopaedic Association Bulletin, First National CME of Hand Surgery, and Journal of Orthopaedic Association in 2004. These are some of the reference. Repeated digital nerve block for pain control after tenolysis, Scandinavian Journal of Plastic and Reconstructive Surgeries. They have published this. Thank you all for kind listening, and if any